4 health checkups you should avoid after 70 that may harm you more than help. Have you ever thought, the more often I get general health checkups, the more peace of mind I'll have about staying healthy? But sadly, science paints a different picture. In a 2016 review published in the Journal of the Indian Medical Association, authors Sharma and Imran cautioned that many routine tests in older adults do not help extend lifespan. On the contrary, they can lead to overdiagnosis, overtreatment, and even prolonged anxiety, especially when false positives make healthy individuals believe they are sick. So after age 70, which tests should you reconsider to avoid falling into an unnecessary medical spiral? In this video, I'll walk you through 4 types of health screenings that may actually pose more risks than benefits when done frequently by older adults. Before we dive in, if you're interested in gentle, science-backed, and practical ways to care for your health after 70 blanks by Beaglex, please subscribe and like this video. Everything we share is based on reliable medical research, and for easy reference, we always include source links in the video description below. Now, let's begin. Number 1. Colonoscopy. Colonoscopy can save lives by catching colorectal cancer before it becomes advanced. But after the age of 70, the way the body reacts to this procedure changes in important ways. The process starts with bowel cleansing, which can dehydrate you and disturb your body's salt balance, placing extra strain on the heart. Sedation slows your breathing and lowers your blood pressure. The scope itself moves through the colon, which, in older adults, has thinner walls, more fragile blood vessels, and slower healing. In younger people, a small injury from the scope or from removing a polyp usually heals quickly, but in someone over 70, the same event can cause dangerous bleeding, a bowel perforation, or a heart rhythm problem. When the body's reserves are lower, even minor complications can quickly become serious. The science confirms this change in the balance between benefit and risk. In 2021, Jennifer M. Kolb and colleagues published a meta-analysis in Gastroenterology that reviewed 17 studies across 51,811 average-risk adults under 50. They found that advanced precancerous growths were detected in 3.6% of people aged 45 to 49 and 4.2% in those aged 50 to 59, almost the same. This supports screening earlier in midlife. However, these findings also mean that by the time people reach their 70s, especially without new symptoms, the potential gains from continued screening are smaller. On the other hand, data summarized in a review by the American College of Physicians and multiple U.S.-based cohort studies show that complication rates rise sharply after 75, including perforation, severe bleeding, and cardiovascular events related to sedation. The risk is particularly high in men, who, according to Kolb's analysis, are about 70% more likely than women to develop early colorectal changes, making earlier screening critical for them, but not necessarily ongoing screening late in life. For healthy seniors over 70 with no signs like rectal bleeding, unexplained weight loss, or persistent abdominal pain, less invasive tests, such as stool-based screenings, can check for problems without the same level of risk. Good medicine at this age is not about doing more procedures simply because they are possible. It's about choosing the right ones at the right time to protect your health without unnecessary harm. After 70, the goal isn't just to find disease early, it's to keep you strong, steady, and living fully. Number 2. Full-body MRICT. Full-body MRI and CT scans promise to look everywhere for hidden disease, yet studies show they rarely help healthy seniors. In fact, large-scale reviews find that when these scans are used in people without symptoms, they detect real, life-threatening disease in barely 1 to 5% of cases. Most of what they find are harmless marks and shadows, which pull patients into a cycle of repeat scans, invasive tests, and months of anxiety. The technology itself is impressive. MRI uses magnetic fields to create detailed pictures without radiation. CT uses multiple X-ray slices to build a 3D image but a full-body CT delivers about 10-20 millisieverts of radiation, the equivalent of several years of natural background exposure, which carries a small but measurable lifetime cancer risk. In seniors, slower healing, fragile blood vessels, and reduced resilience mean the harm from follow-up biopsies or procedures can outweigh the slim chance of benefit. Special MRI sequences, like STIRE, were designed to increase sensitivity for detecting tumors, but in healthy people, they mostly increase false alarms. Not life-saving catches. Research confirms that more isn't always better. In 2025, Rahul B. Singh and colleagues reported in Emergency Radiology that when acute stroke patients needed an MRI, targeted CT scout images were just as effective as plain film radiographs for detecting potentially MRI-incompatible objects. While full-body scouts actually missed some findings, this underlines a key principle. Scanning the whole body is not automatically more accurate. In fact, narrowing the focus can improve results. Similarly, a comprehensive review by radiologists Munov and Gutenberger at the University of Nebraska Medical Center, summarizing guidance from the American College of Radiology, the FDA, and the American Academy of Family Physicians, found no evidence to support full-body MRI or CT for asymptomatic, average-risk adults. The practice became trendy in the early 2000s, but quickly fell out of favor when follow-up studies showed more harm than help, especially from false positives, radiation, and the emotional toll, now known as scanxiety, for healthy adults over 70 with no symptoms and no high-risk genetic condition. The wiser choice is targeted imaging only when there's a clear concern. This approach avoids the spiral of unnecessary procedures while still protecting your health. At this stage of life, the best test is the one that answers a specific question, not the one that goes looking for trouble you may never have. That's why, for seniors, full-body scans are more likely to take your peace of mind than to save your life. Number 3. Gastrointestinal endoscopy. After 70, routine gastrointestinal endoscopy, especially colonoscopy or sigmoidoscopy, can sometimes do more harm than good. While these procedures are designed to detect precancerous growths, in older adults, the benefits may diminish and the risks from complications such as bleeding or perforation become more pronounced. Colorectal cancer (CRC) trends highlight why screening guidelines have shifted in recent years. Epidemiologic data show a 51% increase in CRC incidence among adults under 50 between 1974 and 2013, with much of the rise driven by distal colon and rectal cancers, forms often diagnosed at later, more dangerous stages. In response, the American Cancer Society 2018 and the U.S. Preventive Services Task Force 2021 lowered the recommended screening start age from 50 to 45, based on microsimulation models showing greater life years gained and improved efficiency ratios when starting earlier. In 2022, Wenji Ma, Molin Wang, Kai Wang, and a team of colleagues published a landmark prospective cohort study in JAMA Oncology that tracked 111,801 U.S. women over 26 years. Their analysis compared women who underwent lower gastrointestinal endoscopy with those who did not, focusing on the age at which screening began. The results were striking. Women who started screening before the age of 45 experienced a 63% lower risk of developing colorectal cancer compared with women who never underwent screening, while those who began between the ages of 45 and 49 saw a 57% reduction in risk. When the researchers looked only at cancers diagnosed before the age of 55, often classified as younger-onset colorectal cancers, the protective effect of early screening was just as clear. Screening before the age of 45 was linked to a 45% lower incidence of these cases, and starting between 45 and 49 was linked to a 43% lower incidence. The site-specific analysis revealed particularly strong protection against cancers of the distal colon, where risk was reduced by 87%, and against rectal cancer, where risk fell by 65%. However, no significant reduction was observed for cancers of the proximal colon. Together, these findings suggest that both the timing of screening and the anatomical location of tumors within the colon are critical factors in determining how effective endoscopic screening can be. However, these benefits are most meaningful for younger, higher-risk groups. In seniors, especially over 70, life expectancy, slower tumor progression, and increased procedural risks mean the balance can tip away from net benefit. That's why, for many older adults, especially those with prior negative screenings and no alarming symptoms, further routine, lower GI endoscopy may not improve outcomes and could instead expose them to unnecessary harm. Number 4. Measure bone density too often. Excessive bone density scans in older adults may offer more anxiety than answers, especially when repeated without a clear clinical indication. Bone remodeling is a slow process, and meaningful changes in bone mineral density, BMD, often take years, not months, to appear. Current osteoporosis screening guidelines, including those from the U.S. Preventive Services Task Force, recommend that most postmenopausal women and older men at risk for bone loss undergo dual-energy X-ray absorptiometry, DEXA scans no more frequently than every 2 years. This spacing is intentional. It limits unnecessary radiation exposure and helps clinicians avoid misinterpreting normal, minor variations in bone density as actual deterioration. Such overinterpretation can lead to prescriptions for medications that may be costly, carry side effects, and offer no real benefit to the patient. The reasoning is supported by growing research. In 2025, Takaru Akabane and colleagues published a study in the European Spine Journal showing that vertebral Hounsfield unit values measured on CT scans strongly correlate with bone density obtained from DEXA. More importantly, their findings revealed that significant structural weakening of the spine, the kind that can influence surgical outcomes after percutaneous posterior spinal fixation, unfolds slowly, over months or years. This means that testing at shorter intervals offers little extra predictive value while driving up healthcare costs and adding inconvenience for patients. In practice, less frequent, well-timed scans not only safeguard accuracy in diagnosis, but also ensure that treatment decisions are based on meaningful changes rather than noise. In other words, when it comes to bone scans, less frequent checkups can actually give you a clearer, more reliable picture of your true bone health. Thank you for staying with us until the end of the video. We understand that after the age of 70, every health-related decision carries many concerns. We hope today's gentle and science-based insights help you feel more confident in choosing the necessary tests and, more importantly, in avoiding those that aren't worth worrying about. We wish you continued good health, a peaceful life, and full autonomy in your journey of self-care. If you found this helpful, please hit subscribe so that each day we can take one small but steady step together toward a truly fulfilling old age.